It's 2020 and Bob, a 92-year-old, is admitted to hospital having experienced weakness down the left side of his body. Hospitals are super specialty referral centres with superb diagnostic tools. On arrival, Bob undergoes a PET scan and is diagnosed with an ischemic stroke. The senior clinical pharmacist advises that Bob should receive value plays to dissolve his blood clot. Bob's medical card is scanned by a generic health worker and the multidisciplinary team caring for him in the community is identified. The multidisciplinary teams are composed of general practitioners, specialists, nurses, allied health professionals, pharmacists and lifestyle trainers. They operate out of MDT healthcare centres and look after a particular population. They have the facility to do minor procedures, some acute care, and also chronic disease management for those chronic diseases that have not yet been eliminated. They also focus on healthy lifestyles and disease prevention. The area pharmacist in the multidisciplinary team is responsible for ensuring that medicine management is optimised in this population. The area pharmacist is contacted by the generic healthcare worker and comes to the hospital to provide information on Bob's medication. The area pharmacist discusses Bob's compliance, beliefs on medicine, healthcare and complementary medication, and also his understanding of his medication with the junior clinical pharmacist. The junior clinical pharmacist confirms Bob's medication and sends the order electronically to the robotic dispensing machine. The dispensing and supply of medications to the ward takes 5 minutes. Whilst visiting the hospital, the area pharmacist also meets with the senior clinical pharmacist to discuss Bob's treatment and any likely changes. He also requests a consult for a difficult medicine-related problem that is present in one of the patients who was seen at the health centre earlier that day. The senior pharmacist agrees to link up via video phone later that day to discuss the problem. Within 2 days, Bob is well and is returned back to his home. The area pharmacist is contacted prior to discharge and the new medicines are delivered to Bob's home within 30 minutes of him arriving there. Bob will be followed up at the MDT Health Centre and will not have to go back to the hospital for rehabilitation.
Take another one.